Hello, my name is Lieutenant Holbrook. This is my class BLS and CPR for the professional rescuer refresher course where saving lives starts with the basics. Okay, our learning objectives. Today we're going to basically cover these 4 topics: how to recognize and assess a victim, how to initiate CPR, rapid action for a non-traumatic patient, and then rapid action for a trauma patient or a severe bleed. Okay, we're always, when we arrive on scene, we're going to do a size up upon arrival. So what does that mean? Scene safety, BSI, body substance isolation. We're going to locate the victims. You might start with asking, did you call 911? Where's the victim? You're going to gain relevant information. How many patients are there? What did they observe? What caused the event? And pertinent past medical histories. Do you have diabetes, history of heart disease, history of smoking? This is at the top for a number of patients, because if you have more patients, obviously you're going to call for additional resources. Okay, so you found your patient, you've gone down, and you need to assess level of consciousness. So we go by AVPU, so that's alert, verbal, pain, and unresponsive. So this is a basic run through how to be. Say, hello, can you hear me? John, can you hear me? So he's not alert to verbal. We're going to go to pain. We're going to trap squeeze. John, can you hear me? Can you hear me? Just turn him up. Okay, the patient's unresponsive. The next step is to check the carotid pulse. Okay, you wait 10 seconds, no pulse for 10 seconds, we're going to initiate CPR. Alright, we're going to check, after you've established there is a pulse, there is not a pulse, we're going to do check respiration. So you have normal, labored, and apneic. So normal is you're getting good tidal volume. Of course, labored means you're struggling to breathe, they're having some maybe stridor or choking. Apneic, they're not breathing. Anything other than normal breathing, which is less than 8 breaths per minute or more than 20 per minute, you're going to need positive pressure ventilation. Agonal breathing, which usually follows in a cardiac arrest, is also ineffective. And you need to ventilate that patient. Okay, if patient does indicate need for CPR, remember the priorities of CPR is CAB D. Chest compressions, airway, breathing, defibrillation. CAB D. Alright, for your chest compressions, you're going to push hard and fast in the center of the chest, locate the sternum. See your shoulders are over the top of the victim, and let it recoil fully. And I'm going to deliver those at 100 beats per minute. You can think of 2 songs that are 100 beats per minute. That's Another One Bites the Dust and Staying Alive. Okay, your airway, you're going to sure pain your airway and monitor for if they vomit, if they have gastric distension. So you're going to open your head tilt, chin lift, and then your jaw thrust right here. Jaw thrust. Okay, breathing. We're going to deliver the breaths. This is going to be our emotional bag and valve mask. We're going to deliver those slowly over 1 second. 1,000. And we're going to give our 2 breaths. When you're just ventilating a patient without doing chest compressions, you're going to give 1 slow breath every 4 to 6 seconds, or every 5 seconds. Alright, and then of course there's defibrillation. This is our emotional defibrillator right here. You're going to use your AED for this class. Okay, open airway. We've already covered the 2 techniques: the head tilt, chin lift, jaw thrust. So this is our rapid action for non-traumatic. We're gonna open that airway using the 2 techniques. Then we're gonna check for a pulse. If no pulse for 10 seconds, we're gonna give 5 cycles of CPR, of chest compressions and breaths, and ratio of 30 to 2. Of course, once again, compressions are performed at 100 beats per minute. And you can think of another staying alive, or Another One Bites the Dust. Okay. So after we've done our about 2 minutes of CPR, which is 5 cycles, we're going to go ahead and deploy the AED. So it's a very simple process. We're going to take our AED, we're going to power it on. It'll indicate it's powered on. We're going to plug in the pads and apply them to the patient. Of course, right here and right here. So right side of the chest, above the heart, and left lateral side of the heart. So the power of the pads goes through the heart. We're going to clear the victim. So when the power's on, pads are plugged in, applied here, and we're going to clear and analyze sarcoma. So I'm clear, you're clear, everyone's clear, analyze. It'll analyze, it might take up 10 seconds, and if shock is indicated, clear again, and shock. If no shock is indicated, we move to step 5, which is continue CPR at a rate of 32 and do 5 cycles. So we do another 5 cycles, 2 minutes of CPR. We're going to indicate, usually we indicate to transport. We've been on scene about less than 5 minutes now. We've done 4 minutes of CPR or 10 cycles, and we're going to probably move to a stretcher backboard after our second 5 cycles of CPR. We're going to want to transport patients to the nearest ED per department protocol. Okay, rapid action for a trauma patient. Okay, we basically go by these 4 things: stop the bleeding, start the breathing, protect the wound, treat for shock. Okay, first, stop the bleeding. So we have a 5-step process. You'll notice that number 4 has changed. It used to be pressure points. It's now pressure dressing and direct pressure is 1. So we're going to secure a bandage to the bleed. We're going to apply direct pressure with a gloved hand. We're going to elevate if it's to an extremity. We're going to elevate above the heart. If they're conscious and they have a head injury, we're going to sit them up in a semi-palace position. Number 4 step. If it still hasn't bled, you've checked it every 2 minutes for effectiveness. If it still doesn't stop the bleeding, we're going to apply pressure dressing. You can use a triangle bandage. You can use an ace bandage. You can improvise with a sling. Some nice departments will have the compression dressing. It's prefabricated. All right, if that doesn't work, we're going to apply a tourniquet, which we'll cover in the practical app. Okay, again, you're going to go through all these steps, and you're going to reassess after about 2 minutes. Okay, start breathing. So again, we're going to open the airway. We're going to assess the indication or the need for an OPA or an NPA. So that's a nasopharyngeal airway or a oropharyngeal airway. We're going to ensure the breaths inflate the lungs. So what you're looking for when you give the breath, good tidal volume. So we're looking for good tidal volume and looking for good chest rise and fall. Unfortunately, Bob here is really old, so it doesn't work well, but you know what to look for, good chest rise and fall. Okay. As a side note, we're going to cricode pressure is no longer indicated. Of course, you do this to make sure it gets in the lungs. You'd have somebody push cricode pressure. As of 2011, it's no longer recommended. Okay, we're going to apply supplemental oxygen. So, of course, it goes in the back of your bag. If you have just a pocket mask, a lot of times they have a plug in the end. You can put it, and we're going to get the oxygen to the patient as soon as we can. Okay, so we have stop bleeding, start the breathing, protect the wound. Okay, so for a chest neck trauma, the immediate action is, say you have a pneumothorax, you see that you do an exam, you see the gloved hand right away. Same for the neck. If you want an air embolism, gloved hand on it right away. Okay, if it is a pneumothorax, we definitely want a gunshot wound or something. We want a gloved hand and then apply a 3-sided occlusive dressing. So it's not going to let any air in, but it'll let air escape. Gauze on top of occlusive dressing. So what we can do, we can take a gauze pad. One of these will work. Put the occlusive dressing on, 3-sided tape, gauze on top, and we're going to secure that dressing so we don't have to touch it anymore. All right. After that, if this is a CPR, this is a coded patient, we're going to continue with our 2 respirator CPR. and 30-2 ratio. All right, for injury to extremities, follow bleed stop procedures. We're going to mobilize that arm, if it's an arm or a leg, and we're going to proceed with 2 rests CPR if indicated. Head trauma. First, most important is C-spine precautions, because remember the mantra, first do no harm. So if you're having an apneic cardiac arrest and you have a concern about breaking the C-spine, we're going to do the C-spine first and try to get him CPR. So we're going to maintain this, put the C-collar, put the backboard, and then we're going to try to continue CPR as fast as possible. Okay. If they have a laceration and they have a C-collar, we're going to get the C-collar on first. We're going to stabilize the head, apply the bandage, then the C-collar, then CPR. Okay. Lastly, in the traumatic patient, treat for shock. Unless contraindicated by a spinal injury, you don't want to move the patient. So we're going to place the patient in one of these 3, Trendelenburg, semi-Fowler's, or the Fowler's position to help treat for shock. If threat of hypovolemic shock, you want to consider applying a pneumatic anti-shock garment for them. We're going to want to keep them warm, and if they have a family member, companion, or friend, we want them in the ambulance with them. It's comforting to the patient. It makes a difference. Review. Okay, so I wanted to cover why stopping the bleeding is more important than CPR. If you don't have any blood to pump through your body, your heart won't pump. So it's important that you don't lose all the blood. You want to stop the loss of blood before they start going into hypovolemic shock, because it's really hard to get a rhythm after they've bled out more than 2 pints. So, a couple of review questions for you. What is the first thing we look for, think of, or do upon arrival on scene? BSI scene safety. How do you recognize a patient? Well, they might be unconscious. People will tell you on scene. You might have the 911 caller lead you straight to the patient, or you could just use your own powers of observation. All right, before chest compressions, what must be absent? A pulse. What is the normal respiratory rate for adults? The normal respiratory rate for adults is 8 to 20 per minute. What does ABPU stand for? Remember? Alert, verbal, pain, unresponsive. 2 techniques for opening the airway: head tilt, chin lift. Which 2 songs have 100 beats per minute tempo? Staying Alive, and another one, Bites the Dust. Boom, boom, boom. Another one, Bites the Dust. What are the 4 steps for AED application sequence? So remember, power on, plug the pads, apply the pads, analyze rhythm. Easy done, easy peasy. The 4 priorities of CPR. Remember, that's CAB-D: compressions, airway, breathing, and then defibrillate. All right. Which is more important between C-spine precautions for CPR? First, do no harm. So we're gonna continue with manual stabilization of the head and C-spine precautions before CPR. We do not want to injure the patient. What does BSI stand for? Body substance isolation. That's your glasses and your gloves. Why would you need to transport a traumatic patient sooner than a medical patient? Well, if they're traumatic patient, they have an internal bleed, broken femur, arterial bleeding, they're going to go into hypovolemic shock much sooner than maybe a medical patient in the same condition. That makes sense.